physical therapist with Iredell Health System. Today, I will be going over what to expect following your total knee replacement surgery and how physical therapy will assist your recovery. You will receive physical therapy on a daily basis after you have your total knee replacement surgery. Depending on your surgeon's preference, you may receive physical therapy on the same day of your surgery or the morning after your surgery. From that point forward, you will typically do physical therapy twice a day, once during the morning and once during the afternoon. In addition to physical therapy, you may be evaluated by an occupational therapist to assess any limitations that may arise with self-care, such as bathing or dressing. Our goal is to get you moving as much and as soon as we can so that you can return home as soon as possible. During physical therapy, you will be guided through exercises for your knee, and then you will be assisted with getting out of bed, walking, and stair training in order to prepare for safe discharge home. The exercises are pictured in your total joint replacement binder under the rehab section. After you have your surgery, you will have a peripheral nerve block that will numb the top of your surgical knee to help control post-surgical pain. This block typically lasts 3 days after your surgery. More than likely, you will go home with this nerve block in place. While you still have the nerve block, you will need to use a knee immobilizer, a type of knee brace, and a rolling walker every time you get up. This knee immobilizer helps to keep your knee from buckling when you stand on it or walk on it. The knee immobilizer is used until the effects of the nerve block are gone. This usually takes about 24 hours after the nerve block is removed. Your nurse will show you or a family member how to remove the nerve block at home, or a home health provider can do it for you. Your surgeon may also have you use a continuous passive motion machine, also referred to as a CPM. This machine bends your knee slowly back and forth for you. This machine can be worn while you are not doing physical therapy. In addition to these tools, hospital staff members will assist you anytime that you get out of bed to prevent any possibility of falling. Following your knee replacement, you will experience pain. The pain should improve over time and as you progress with physical therapy. Pain management is an important aspect of your surgery, and you should utilize pain medicine as prescribed, including ice packs, to help control your pain. The goal of managing your pain is to keep it at a tolerable level so that it does not prevent you from progressing in your recovery. Again, while you are in the hospital, you will work with physical therapy twice a day, working on your exercises, walking, and climbing stairs. Our goal is to make sure you are safe to go home. Once you discharge from the hospital, you will likely continue your therapy at home with home health physical therapy. They will assist you with continuing to progress towards your personal goals. These physical therapy services are also available in an outpatient setting for patients that are not homebound. The length of time required for this type of care varies with each patient. We look forward to helping you with your recovery.